mynews.studio.
Picture this: a single cigarette, a vaccine, or even just a plate of vegetables. Could those everyday choices really determine what happens to millions of people when it comes to cancer?
We're recording this on 2026-02-15. There's a major new study from the World Health Organization, and it's finally put numbers to something we've all suspected. Over a third of cancer cases worldwide could actually be prevented by changing our habits, our environment, and what we eat.
That's 7.1 million people every single year. The researchers looked at cancer diagnoses in 185 countries and found that 37% of nearly 19 million new cases could be traced back to just 30 changeable risk factors: tobacco use, infections like HPV or hepatitis, alcohol, air quality, even workplace exposures. And for the first time, they've really pinned down how big a role infections play.
If you dive into the details, tobacco is still the standout. It's behind 15% of all cancer cases globally. So that's more than 1 in every 7 diagnoses just from tobacco. Is that enough to say tobacco control should be the top priority everywhere?
Definitely. That means stronger bans, higher taxes, public education campaigns. These policies have worked where governments have taken them seriously. For example, as smoking rates go down, we see lung cancer rates fall too. But it's not just about tobacco. Vaccines against HPV and hepatitis B are making a huge difference, especially for cervical and liver cancers. Some countries have seen case numbers drop sharply after bringing in vaccination programs.
So, infections as preventable causes of cancer. This feels like a shift. The study counted 9 infections, including HPV and H. pylori, and together those account for about 10% of global cases. In sub-Saharan Africa, especially for women, infections drive more cancer than anything else, up to 38%. If you're making health policy in a country with fewer resources, where do you even begin?
You start with what delivers most impact for the cost. Rolling out vaccination programs for HPV and hepatitis B, testing and treating H. pylori, and putting taxes on tobacco. These steps are much more affordable than cancer treatment, and they've been shown to work, particularly in places where infection rates are high.
The contrast between regions and genders really stands out. Like in East Asia, 57% of men's cancers could be prevented, mostly due to smoking. But in sub-Saharan Africa, it's infections that are the main issue for women. So, does that mean prevention strategies have to be customized for each place?
Exactly. There isn't a universal solution. Some countries need to boost vaccine coverage. Others might need tighter tobacco or alcohol rules. And then you have factors like air pollution, sun exposure, or chemicals at work. Each country, or even each region, faces a different set of risks.
But what about things like diet and exercise? Are they really as important as tobacco or infections when it comes to lowering cancer risk?
They are important, especially as cities grow and diets change. Rising obesity and inactivity are becoming bigger risks, particularly in wealthier countries. Adjusting diet and exercise habits can reduce the risk for several cancers, though the impact isn't as dramatic as quitting tobacco or getting vaccinated. Still, these changes matter for overall health.
The study also warns that by 2040, cancer cases could rise by 50% if nothing changes. That's a huge jump. Is prevention really the only way to stop that curve from getting worse?
Prevention is the only way to actually reverse that trend. Treatments are improving. Think new gene therapies and drugs. But if millions more people are diagnosed each year, health systems just can't keep up. Prevention is both cost-effective and gives immediate results.
So for countries with limited budgets, the priority should be high-impact, affordable steps. Vaccines, tobacco control, education. Maybe working with partners too, like Kenya did with its cervical cancer elimination plan.
Yes, and community involvement is essential. Teaching about healthy eating, staying active, and creating safer environments can add up to big changes. When these simple steps are scaled up, they can save millions of lives and ease pressure on healthcare systems.
So, the takeaway isn't just that cancer is preventable. It's that prevention is practical. These solutions are available, and they really do work.
The real question is whether governments and individuals will actually act. The science is there, the chance to make a difference is right in front of us.
So today we've learned that 7.1 million cancer cases each year could be prevented, mostly by quitting tobacco, getting vaccinated, and making some lifestyle changes.
Prevention isn't just wishful thinking. It's a plan that can start today, in any country and any community.
Thanks for tuning in. This episode comes to you from mynews.studio. Try it out for free.